And I want to thank everyone who is being forced, of course, to do something differently today. Everyone who didn't visit their mum for Mother's Day, but FaceTimed them, Skyped them, rang them instead. Thank you for your restraint and for what you did. Everybody who was forced to close a pub or a restaurant or a gym or any other business, bar, that could have done fantastic business on a great day like this. Thank you for your sacrifice. I know how tough it must be. And I can tell you once again that this government will be standing behind you, behind British business, behind British workers, employees, the self-employed, throughout this crisis. Today we've come to the stage of our plan that I advertised at the outset when we first set out the plan of the UK government, when we now have to take special steps to protect the particularly vulnerable. And you remember that I said that the moment would come when we needed to shield those with serious conditions. There are probably about 1.5 million in all. And in a minute, Robert Jenrick will set out the plan in detail. But this shielding will do more than any other single measure that we are setting out to save life. And that is what we want to do. Also to reduce infection and to slow the spread of the disease. I want to say a bit more about how we interact outdoors. And of course, I do, people to be able to go to the parks and open spaces and to enjoy themselves. It's crucial for health, for mental and physical well-being. But please follow the advice and don't think that fresh air in itself automatically provides some immunity. You have to stay 2 meters apart. You have to follow the social distancing advice. And even if you think that you are personally invulnerable, there are plenty of people that you can infect and whose lives will then be put at risk. And I say this now on Sunday afternoon, Sunday evening. Take this advice seriously. Follow it, because it's absolutely crucial.
The NHS has identified up to 1.5 million people in England who face the highest risk of being hospitalised by the virus. The NHS will be contacting these people in the coming days, urging them to stay at home for a period of at least 12 weeks. I know that many people will want to know whether this applies to them. This will include people who are living with severe respiratory conditions, specific cancers, such as of the blood or bone marrow, those who've received organ transplants, and some, though not all, of those receiving certain types of immunosuppressant drug treatments. Now, I don't underestimate what we're asking of people. It will be tough. But if you are one of these people, I want to reassure you on behalf of the government that you're not alone. We will be with you throughout to support you.